Good morning to everyone. Today we are discuss about the disease condition cardiac tamponade. Cardiac tamponade is the life-threatening complication caused by excessive accumulation of fluid in the pericardium. It is one of the life-threatening complication caused by excessive accumulation of fluid in the pericardium. Compression of all cardiac chambers due to excessive accumulation of pericardial fluid leading to compromised cardiac output. Then what is the definition of the cardiac tamponade? Cardiac tamponade is the accumulation of excess fluid within the pericardial space resulting in impaired cardiac filling, reduction of stroke volume and epicardial coronary artery compressions. They have to about the 3 points: impaired cardiac filling, reduction in the stroke volume and epicardial coronary artery compressions. They have to leads to the myocardial ischemia. Then once again, cardiac tamponade is the accumulation of excess fluid within the pericardial space resulting in impaired cardiac filling, reduction in the stroke volume and epicardial coronary artery compression within the result myocardial ischemia. Then what is the etiology of the cardiac tamponade? First they have to tell about the malignancy, end stage of the lungs tumor. The end stage of the lungs tumor they have to cause for the cardiac tamponade. Then infections, look like some of the viral infections they have to cause for the cardiac tamponade. Viral infections look like HIV infections, they have to cause for the HIV infections. Human immunodeficiency virus also they have to cause for the cardiac tamponade. Then bacterial infections, like example tuberculosis. Mycobacterium tuberculosis is the one of the bacteria they have to cause for the tuberculosis diseases. They have to produce the they have to produce the causes of the cardiac tamponade. Then fungal also they have to, pericarditis also they have to cause for the cardiac tamponade. Then another causes of cardiovascular surgery, open heart surgery, CBG, post coronary intervention, coronary dissection, perforation, post myocardial infarction, connective tissue disorders look like a systemic lupus erythematosus, uremia also they have to cause for the cardiac tamponade. Then next they have to talk about some of the medications, some of the drug also they have to cause for the cardiac tamponade. Example, antihyperthymic drugs, antihypertensive drugs also they have to cause for the cardiac tamponade. Then this is the etiology of the cardiac tamponade. Then next we are discuss about the pathophysiology of the cardiac tamponade. Then according to the etiological factor, any of the causes they have to leads to the fluid within the pericardium. Excessive fluids within the pericardium puts pressure on the heart. The excessive fluid accumulations in the pericardium they have to put the pressure on the heart. Then they have to lead to prevent the heart from expanding completely. Okay, then the pressure prevents the heart from expanding completely and filling to capacity with the blood. Then they have to leads to the less blood leaves the heart. They have to develop to little oxygen reaches the tissue. Anyway, they go for the tissue also. The tissue also they have to little bit oxygen only they have to received. Then they have to leads to the heartbeat also they have to faster, tachycardic also they have to presence. Then rapid blood pressure, rapid fall of the blood pressure, hypotension. Then tachypneic, increase the respiratory rate. Anxiety means because of the symptoms they have to presence, the patient go for the automatically they have to psychologically they have to fear about. Then anyway they have to coming for the anxiety also because of the disease condition. Then they have to swelling of the neck veins also. Then finally the patient go for the loss of consciousness, LOC they have to go. Then finally they have to death also they have to come. Okay, this is the pathophysiology of the cardiac tamponade. Then clinical features of the cardiac tamponade. You have to know about the first one, Beck's triad. The Beck's triad they are containing 3 Ds. The Beck's triad is the collection of 3 medical signs associated with the acute cardiac tamponade. First one, decreased arterial pressure. First D is the decreased arterial pressure, means they have to hypotension. Then second D is the distended jugular veins, means jugular venous pressure. Distended, second D is the distended jugular veins. Then third D is the decreased arterial pressure, diminish the heart sound, decreased arterial pressure. The 3 Ds containing the Beck's triad. First one, decreased arterial pressure, distended jugular veins, and decreased arterial pressure. Then other symptoms also they have to present for the cardiac tamponade. First one, tachycardia, narrow pulse pressure, dyspnea, cyanosis, lips and nails, restlessness and anxiety, muffled heart sound. Because of excessive accumulation of fluid, they have to call for the muffled heart sound. Then decreased the QRS voltage. Then weight loss, agitation, stupor, weakness, loss of appetite, also the signs and symptoms, clinical features of the cardiac tamponade. Then next we are discuss about the diagnostic measures. What are the diagnostic measures they have to find out the cardiac tamponade? Then first one, they have to collect the history. If they have to comfort the patients in admitted for IP, and they have to inpatient in the ward, and they have to coming for the OPD, you have to ask about the patient history. You have to affected any cardiovascular diseases or taking for any cardiovascular treatment, and you have to collect all the history about the patient. They have to helpful for the treatments. Look like the example for the cardiovascular disease, coronary artery diseases, myocardial infractions, cardiomyopathy. If any attack, they have to presence for the patient. You have to taking any medications for the, you have to carefully noted, and they have to help. Then next you have to go for the physical examinations of the patients. Then first you have to do for that you have to watch the patients, the respiratory rate. The patient go for the tachypnea, because of the reason reflect the elevated pulmonary venous pressures. Then next the patient's tachycardic also, they got the heart rate also, they have to much faster. Then because of the reason low cardiac output state. Then hypotension, in severe patients they have to affected for the hypotension due to the decrease the stroke volume. Then you have to watch about the Beck's triad also, you have to do for the physical examinations. Then they decrease the heart sound, arterial pressure, then distended jugular vein also you have to check. Then jugular venous distension, due to the impaired venous return, they have to cause for the they have to jugular vein, they have to distended. Then muffled heart sound, due to the fluid inside of the muffled heart sound, they have to present due to the fluid inside of the pericardium. Then some of the blood investigation they have to find helpful to find out the cardiac tamponade. First one, they have to complete the blood count test, then renal function test, liver function test, PT, INR, CKMB, troponin, NASI, RH factors, HIV test, MANTAS test also they have to do for these patients. Then next they have to go for the ECG. Some of the ECG variation also they have to present for the cardiac tamponade. Then sinus tachycardia also they have to present. Then low voltage QRS complex for in the ECG. Then chest X-ray, you look at chest X-ray, the patient's the view of the heart, they have the large globular heart they have to present. Means the water bottle shape of the heart, they look like you have to take the X-ray, they have to see about the large globular heart or water bottle shape of the heart. Then echo, next go for the test, do for the echo. There is the test used to high frequency sound waves to examine the size, shape, motion of the heart. The echo is too useful for the size, shape and motion of the heart. Then other test, cardiac catheterization, CT scan, MRI, coronary angiography also they have to do to find out the coronary cardiac tamponade. Then management, what is the management of the cardiac tamponade? We are discuss about the management. Then the main aim of the client with the cardiac tamponade is the three main goals. First one, save the patient life. Second one, improve the patient heart functions. Third one, relieve from the symptoms. First one, save the patient life, improve the heart functions, and relieve from the symptoms. Then next the patient go for the medical. Next we are discuss about the medical management. Then first one, supplemental oxygen. They have to given for the patient, administer for the supplemental oxygen. Because the uses of that to reduce the workload of the heart. If oxygen administered the patients to reduce the workload of the heart. Then next you have to administer IV fluids. IV fluids to maintain the normal blood pressure of the patients. IV fluid to maintain normal blood pressure of the patients. Then next you have to treat about the administer antibiotic to help to prevent the infections of the patients. And then next to go about the inotropic drugs. If the patient severely in hypotensive, the patient go for the severe hypotensive, you have to administer the inotropic drugs. If the patient go for the hypotension, in severe hypotension, you have to administer for the inotropic drugs. Look like a dopamine, dobutamine. This is the drug they have to start it for these patients. Then next you have to avoid the diuretics and vasodilators. This patient they have to avoid diuretics and vasodilators. Then take the patient to take bed rest. Bed rest to with leg elevation. Bed rest take and with the leg elevations. Because of the reason helps to return the venous return. Because that helps to venous return. And then a positive pressure ventilation should avoid. It may decrease the venous return and aggravate the symptoms of the tamponade. Then this is the medical management of the patients. Then next you have to discuss about the surgical management of the patients. The surgical management is the pericardiocentesis. What do you mean by the pericardiocentesis? Pericardiocentesis is the excessive fluids present into the pericardium. They have to removal of fluid into the pericardial space. Okay, this is the procedure they have to do and relieve the patient's symptoms. Then, thank you.